Well, it's noon, so let's get started. It's good to see everyone. Jessica, shall we, and I really enjoyed the conversation here before we got started, so that's fun. Jessica, shall we do the Pledge of Allegiance? All righty. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with justice and liberty for all. All righty. So Allison, would you give us your inspirational words and invocation for today, please?
Yes, President Sue, thank you, and happy Wednesday, everybody. Allison Kelly with Liberty House. And would you please join me in an attitude of prayer? Eternal God, source of all goodness and love, in you we live and move and have our being. Thank you for Rotary, for all the members present here today. Thank you for the gift of spring and sunny weather. We are mindful of all those in our community who are suffering, who are unsheltered, and who may be struggling with physical or mental illness. We are very grateful for the amazing organization that is Salem Health and for all they do for our greater Willamette Valley area. We are grateful for their leadership, their vision, and for continuing to develop innovative resources to help community members become more knowledgeable about their health. Thank you for all those who work in the Community Health Education Center and the ways they assist our community. As we move through the rest of this day, we ask that you please bless and protect all of us, all of our families and loved ones. Help us to see you in our neighbor and help all of us to work together to create a healthy and thriving community. Amen.
Thank you, Allison. So I just scrolled through the guests. I don't see Vincenzo yet, but if Allison, if he does hop on, let's just holler at me and we'll make sure that we introduce him once again to the group. And then we have one Rotarian guest, and that is Mary Louise Van Atta from the South Salem Rotary. And her category is, as we all know, public relations. So it's always great to see you, Mary Louise. Thank you. And I'll give a shout out while you're here is that Jessica's just doing a fantastic job for us with technical support for our meetings. It's she's definitely saved my sanity, which is whatever's left of it. Maybe I'll say it that way, but she's just doing a fantastic job for us. So thank you.
Check in on her.
Thank you very much, Sue.
You're welcome. Thank you. I don't see any announcements, so we're cruising through this right now. So I'm going to hand it off to you, Brenna, for bell ringers.
I will second the sanity that Jessica brings. Appreciate that very much for our club and all the work that she does for us. I have no bell ringers today. So how do you feel about that? There is good news out there. The sun is shining. I know people have good stuff to share, and a few of you told me you had some things to share from the floor. Sue, do you want to kick us off with your bell ringer?
Absolutely. I have two bell ringers. First off, I want to thank past President Tom Golden for facilitating our meeting last week while I was here virtually with my board members. So Tom, I really appreciate it. Your leadership and willing to hop in and help me out. So thank you so much. And then I wanted to thank Cindy Linesar and Nancy Baldwin, who's our presenter today. I called Cindy late last week and I said, what do you think about talking about a well child clinic later this year to align with our annual back to school health fair and backpack giveaway? And Cindy and I brainstormed a little bit, she took all the information, and then within a couple days, Cindy had reintroduced me to Nancy to say, let's talk about how we can make this happen. So really appreciate your partnership and willing to work with us to put on that event at some point later this year. So appreciate it very much. So 2 bell rings.
Thank you, Sue. I also heard from Tim Nissen, who has a bell ringer from the floor.
Yes, I received a letter yesterday addressed to President Sue, which I will scan and email to her, but I wanted to share it with the group. Dear Ms. Bloom Asset Mark, Inc. is pleased to donate $10,000 to the Salem Rotary Foundation, doing business as the Jerry Frank Salem Rotary Amphitheater, in honor of Barry Nelson,
Oh, very
who
cool.
is a recipient of our 2020 Community Inspiration Award. Please note the donation is sent on, oh, we don't need that part. We created the award to honor financial advisors across the United States who have inspired others by supporting charitable organizations in their communities. Advisors are selected in recognition of their volunteer work, community leadership, and commitment to serving their local communities. So a big deal, nice recognition for Barry, and another $10,000 towards the amphitheater. And
That's
President
fantastic.
Sue, you can make a big deal of it sometime when
When
Barry is present, because I don't see him here today,
Right.
but I wanted to let the rest of the group know. So
Thank you for that, Tim. That's exciting news and very well deserved by Barry.
Yeah, Asset Mark is a huge player in our industry, so that's a big deal and well deserved, very much. Ron Kellerman, you have a bell ringer, I heard.
Actually, I just thought I'd make two of them. The first one is last Friday marked the second week of our second vaccine. So we partied up with Tim and Pam Nissen downtown at, I forgot the name of that restaurant, Tim. I keep wanting to call it Paradiso. And then we adjourned to his place for a bottle of wine for another couple of hours. And then the next night we had friends over and played Cards Against Humanity until about midnight. So it feels good to be vaccinated and life slowly getting back to normal. In fact, we went to a movie last night too. We went to see the one that's been getting all the awards, the Nomadland. Really good, really sad. So that's one bell ringer. And the second is for Brenna, wishing her good luck in her new venture. I'm sure she'll do well.
Thank you, Ron.
Yeah.
Any other bell ringers? Don't see any other hands. So Sue, I'll turn it back over to you.
Okay, great. Thank you so much, Brenna. We're excited to hear about your new path, your new journey. So Allison, you said Vincenzo's here. Would you like to introduce him again to us?
Yep, thank you, President Sue and fellow Rotarians. Again, Allison Kelly, Liberty House. I'm happy to welcome our guest, Vincenzo Maggiore, the Executive Director of Enlightened Theatrics. He is going to be welcomed into our Rotary Club on April 14th. And he does quite a bit for our local community, and he's also a Liberty House board member. So thank you for the opportunity to welcome Vincenzo.
Thank you.
Great,
Glad
wonderful
to
to
be
see you again, Vincenzo, and we're
You
super
as well.
excited to have you be a member. So
Thank you.
yay. All righty. Jessica, we have our hunger awareness, I'll start again. Our hunger awareness moment. And this week is actually a short video that Robin Kerner and her team put together for the Boys and Girls Club for our meal program. So if we could kick that off.
Yes.
Please.
Just a second. I had it all ready, and then just a moment.
It wouldn't be a problem if Mary Van Natta wasn't watching.
Oh, sorry, guys.
I'm always watching all the time.
Video sharing can sometimes be. Okay, here we go. You see it?
Yes.
Okay.
Hi, everyone. My name is Robin Kerner, and as many of you know, I was at the food share for many, many, many years. I love the good work that they are doing for our community by supporting our hungry neighbors. I'm proud to continue to partner with them to ensure kids are getting healthy, nutritious meals through your work at the Boys and Girls Club, where I am now the Chief Development Officer. Throughout the pandemic, the Boys and Girls Club, and so many of us, have learned the finer art of the word pivot. Honestly, if we never have to hear that word again in our life, it'll be too soon. but like many of our partners, as a local nonprofit with over 50 years in this community, our supporters joined us in flexing our programs to the areas families needed us most. I'm going to share my screen. We know that the kids we serve are at an even greater risk for negative impacts from the pandemic. In fact, kids and teens from low-income families are experiencing learning loss at a greater rate than their peers. According to local teachers, many kids haven't even logged on once to class to do remote learning. Lack of supervision and resource heightens child abuse and neglect. Kids and teens are facing increased mental health issues due to lack of accessible services, limited social interactions, and new traumatic experiences due to the pandemic. And families are experiencing greater food insecurity. Thanks to the generosity of our community and many of you, we have been able to open 3 of our clubs for 10 hours a day, give kids a space to connect to the internet, log into their classrooms, interact safely with their friends, and stay physically active. And we've also seen an increase in demand for nutritious meals. In addition to continuing to provide free nutritious meals to the kids in our building every day, we are also able to provide fresh produce to 500 families thanks to the partnership with Marion Polk Food Share at our drive-through health fair and school supply distribution. 750 fresh produce and protein boxes to families thanks to local supporters like you. 109,000 grab-and-go dinners to kids and teens through the partnership with Fresh and Local Foods. In all, thanks to supporters and partners like you and state funding for meals, we were able to support over 10,000 kids and teens. Thank you.
Terrific. Yeah, important stuff. So thanks for letting us share that. Shane, let me know that Kelly Parosa is in the house. So Allison, do you want to introduce Kelly to the membership, please?
Thank you, Jane. Thank you, President Sue. Yes, it is my honor to introduce Kelly Parosa, who serves as the Prevention Department Director here at Liberty House. Many of you may know Kelly. She's been instrumental in facilitating Stewards of Children. And I've been working with Kelly, and Cindy Linesar has been involved. Sue's been involved with a radical new project called I Respect and Protect that we've talked about briefly here at Rotary. So Kelly does interact with the Community Health Education Center. And when I saw that this was going to be on the program, I wanted to invite her to be part of it. So thank you, President Sue. Welcome, Kelly.
Yeah, welcome, Kelly.
Thank you,
yeah, you do amazing work, Kelly. Thank you for being here.
You're welcome.
All right, so we're cruising through our time. So I'm going to hand it off to Cindy as the program chair, and we'll kick off our program.
Wonderful. Thank you, President Sue. Everybody, I am Cindy Linesar, and I am the Community Relations Liaison at Salem Health. First, I'd like to introduce our virtual head table. Breaking from tradition of seating 2 to 4 people at the head table, I would like you to look at your screen and see all of your fellow Rotarians. You are all at the head table.
Yay!
You all may have, could have, or will seek care at one of Salem Health's hospitals or clinics. And due to that fact, besides the fact that we all live in Salem Health's service area, you have the opportunity to access the Community Health Education Center and the Pierce Resource Center and Library, for which that program is today. As a note of interest, the Pierce Resource Center and Library was named after our late fellow Rotarian and her husband, Dr. Selma Pierce, DDM, and Dr. Bud Pierce. Please give yourselves a round of applause for being our head table. Probably the biggest in history. Now, fellow Rotarians, it is my privilege to introduce my colleague and friend, Nancy Baldwin. Nancy is the supervisor of the Community Health Education Center, better known as the CHEC, and has been a health educator for over 20 years. She has a lot of credentials, including certified exercise specialist, licensed childbirth educator, and licensed tobacco treatment specialist. She attended Southern Oregon University in Ashland, go Raiders, and majored in physical therapy. She's a featured speaker, group facilitator, and community outreach educator. And she has dedicated herself to the health and well-being and support of patients and their families in our community. Nancy's a native Oregonian, a proud mom of 3 adulting children, and they all enjoy getting out and exploring what our state has to offer. With that, please help me welcome Nancy Baldwin.
Thank you so much for having me. I appreciate this invitation so much. And really just feel like it's just an honor and a privilege anytime I have an opportunity to talk to leaders in our community about something that's so dear to my heart, which is community health and our fabulous center here at Salem Health, the Community Health Education Center. I have a couple different ways of going about kind of giving some background information. One is a quick video that we shot that kind of shows you the center itself and kind of goes through some of the details of the center. And then we can just look at some images. I'll talk a little bit more about what we do here, what we offer in terms of resources, what we offer to you as community partners in terms of education opportunities, partnerships, and collaborations. And then I'll just open it up for any questions that anybody may have. So I'm gonna share here and we will do a quick video. And hopefully the sound thing works. Welcome to the CHEC, the Community Health Education Center at Salem Hospital. The CHEC has been open since 2001. It was made possible through a grant from the Salem Hospital Foundation, where we recognize that we need better resources for health and healthy lifestyles. So what can CHEC offer you? We have a consumer manual, hundreds of books on all medical topics.
Audio is not working.
Nancy, I think, would you mind starting over and doing the sound the way you had it before when we practiced? I think it was better.
Let me see if I can go back to that. Let me see.
So go ahead and try screen sharing again and click, yeah, there you go.
Let me see if that works. All right. If this doesn't work, it's okay, because we can always change gears and I'll just switch over and we'll just go through we'll just go through the images and talk about each one. So that works as well. Does that work? Welcome to the CHEC, the Community Health Education Center at Salem Hospital. It's okay. So I'm going to switch over. This is easy to do. Technology is a beautiful thing. Is that sharing? Okay, is that sharing as well?
Not yet.
Yeah, let me try one more time. Sorry.
Are you looking for your PowerPoint slides?
Yeah. Do you have them? Can you pull them up since I can see them, but it's not, for some reason, even though it says it's sharing, it's not sharing.
Did you send them to me?
I did, yeah.
Why don't you keep trying?
Okay.
I don't see
Yeah.
them.
That's okay. I can grab them again. You know, this is going to be a whole new world when we go back to seeing people in person.
Right?
After all this.
Do you have the slides on your desktop?
They're right here. It's just when I hit share screen that it's, for whatever reason, it's not picking it up. But
Oh, there they go.
Did that work?
There.
Yep, we see it.
Okay. Let me see if I can actually get it to go to what I want, though. How's that? Better? What? It's perfect. All right. Thanks for your patience, everybody. So this is just, we'll just kind of tap through this. The Health Education Center has been open since 2009. We, Salem Health Foundation, Salem Hospital Foundation, with a lot of generous donations from community members, built this center with a vision to provide resources to our community related to health and wellness. And we did some traveling across the country, looked at other centers like it, and designed this center to be built around the needs specifically for our community, but also to work well into the future to meet the needs of our individuals and patients, family, staff, everybody. So the center itself has a physical space on the Salem Hospital campus. We're in building D as in dog, which is our family birth center. And the CHEC Center is located on the first floor. We have several rooms, classrooms, wellness kitchen, all of that, a library, a staff library. And then we also have a second floor that houses physical activity space and such. About 1/3 of our work with community members happens in our physical space, only about 1/3 of it. And that's a fair amount. So we're seeing roughly about 70,000 individuals in our physical space. 2/3 of our work throughout the year happens out in the community or working through community partnerships, whether that be Boys and Girls Club, Liberty House, Hope, all these different agencies throughout Marion and Polk County we work with to provide health education and resources. We do screenings and a variety of different things as well, and just help people get connected to information. In our physical space, we have a consumer library. That area is open to community. We are currently open. We have additional COVID protocols, as everybody I'm sure has in their spaces as well. So that we're distance, clean, safe environment for people to come in. It doesn't cost anything to access library services. You can check out books for no cost. You can get on the computers and have help. We have a master librarian, Paul Howard, who is here and available not only in person, but also if you call into the center to help people navigate resources online. So a lot of people look for information about their health diagnoses or things like that. And they tend to kind of Google, and you're not ever sure if you're getting the most reputable source. And so Paul can help you navigate to current evidence-based sites that can give you accurate information. We also seek to meet people where they're at in terms of their learning styles and their health literacy. So we offer shelf models, posters, interactive activities, if we have somebody come in that's learning about, say, a new diagnosis of diabetes, we can take them through the models, and they can, if they're a kinesthetic learner and they need to see it, feel it, touch it, we can take them through step by step each of the organs and talk about how this disease affects the whole person, the whole body, and then help them develop a plan to manage this moving forward. So there's a whole variety of ways that the library is utilized to provide education to people that go way beyond just having them come in and peruse the shelves and check out a book. This is the entire center and library is that Pierce Resource Center that Cindy mentioned. And so we're just grateful to continue to be good stewards of the funds that were provided to us. It is notable that out of the $4 million that was raised over 10 years ago to put this center together, that we completed this project early, and that we did it under budget. And that's kind of unheard of nowadays. So we're very proud of that. And as I said, we continue to be good stewards of the funds that have come into us. We have a wellness kitchen. So this is a working functional kitchen space. We have cameras angled over all the worktops and the stovetop. And we provide in-person classes as well as video classes for individuals. We've done everything from your standard healthy eating to and low sodium types of things for heart health. We've done skills for disabled youth, learning cooking and prepping skills, knife skills. We actually did a blind cooking class for a group of individuals who are sight impaired and want to be as independent as they can possibly be. We do cooking classes for people coming out of incarceration that need to learn how to integrate back into society and haven't had to use those skills in a long time. You name it. We work with Boys and Girls Club and have youth come in, and we talk about healthy snacks and how they manage that on their own as well. So a lot of things going on in this. And once COVID is over and hopefully we can get back to some semblance of normal, we did date night cooking classes. And those were a lot of fun. You can come with a friend, come with your special person, and you get a chance not only to watch the demo, but you actually eat while you're here. So we're excited to kind of get back to that at some point as well. We have a support group room space. This space, as with all of our spaces, is dedicated to the community. So even though these spaces are housed within our walls, these are available for partners to utilize. So people can call us and if they are in need of space, and support groups was a big thing in our community where space was at a premium. We offer utilization of our space for no fee for support groups, and we provide some registration support, some marketing, things like that with those groups. We have over 30 support groups in the community that we support in one way or another, whether it's through space or other coordination. So lots and lots of opportunities there if people are looking for that peer-to-peer support or shared experience and want to have that as part of their recovery model. We have 2 large classrooms. The classrooms are set up with all the technology, current technology. The spaces themselves hold about 30 to 32 people. If we open up the large space, because we can open up the wall, we can take 70-ish people at a time for large events or large group trainings. Again, we offer a lot of classes ourselves, everything from beginning of life, childbirth type of classes through joint, back, pain, brain agility, fall prevention, kind of a little bit of everything across the board. And we also do host other groups and trainings that are wanting to come into the space and provide that. The one thing I did leave out there as well is that we support the QPR, which is a suicide prevention trainings as well through our space. And this is just kind of another list of classes. The reason that it's important to have you guys look at this is because even though we are in a pandemic, we are still providing education. And so anybody in this group, or if you know of any organizations that would like support or education for their staff, for any of their clients that they're working with, you can contact us at the center and we will provide that education to your groups. So these are just a small sampling of some of the things that we do both internally and as a community outreach, but we can do smoking cessation, we can do resiliency, a lot of heart healthy things, you name it, we kind of run the gambit on it, and we're happy to just meet the need wherever it is, whether it's here or elsewhere. So we have a second floor area that is a full exercise space, and we do teach classes in that space as well. And a lot of these classes are meant to be a conduit. They're not meant to replace opportunities in the community. We're not a gym. We don't want to be a gym. What we are is a healthcare facility that has the capacity to be able to build the bridge so that people who are experiencing health-related issues can actually get comfortable, get confident, get the strength they need to be able to go out and access those local resources. So we do classes that are specific to cancer patients, Parkinson's patients, arthritis, and really anybody that's in process and just isn't quite ready or comfortable or doesn't know what they need to do. We are here to provide that level of support and education and get them over that bridge and connected to those resources in the community when they're ready. We do a lot of outreach in terms of screenings. So we do cholesterol screenings, we do bone density screening, blood pressure checks, all of those things can be available to you upon request if you have a group or you know of, or if you would like to be part of an event. We work with other organizations, and I think, what we were talking about with Boys and Girls Club, and Sue mentioned, these types of events where we can have families in need just show up or drive up, and we can provide a plethora of services to families. That's the exciting part of our work, right? Is getting out and doing, facilitating change. And we have everything we need. And it's when we connect in this way with partners that big things happen. And so lots of really cool stuff that we get to do for outreach. And we're happy to have discussions, help with coordination, or play a role in anything that you guys may want to put together. Our contact information, the center here is open Monday through Friday from 8 to 5. You can always call the center. We do have people answering the phone directly, so you don't get sent down any kind of phone tree. You certainly can go to our website, which is salemhealth.org/CHEC. And all of our classes, programs, and events are listed on there, as well as speakers requests, things like that can all be accessed through our website. And you can send information that way, or you can contact myself or Cindy directly, and we're happy to get you connected. Any thoughts, feelings, or questions?
Folks can put it in the chat for Nancy, or you can raise your hand, whatever is your preference. And Cindy, Nancy, I just have to say that just before COVID, we were bringing groups of kids over to that kitchen and working with your chef, and that was just so enjoyable and so educational. They came back just charged up. So it really was wonderful, and we're looking forward to when we can do that again. So thank you for that and everything that CHEC does for the community. It's pretty amazing. You've come over and done like resiliency trainings with us and a whole raft of things, both for our kids as well as for our staff. And it's really very much appreciated.
Yeah, we are so grateful to get out there. And, you know, right now is a time where we are providing a lot of additional help and support in terms of burnout for our community partners. A lot of us, a lot of you sitting at this table do this work in the community. And, you know, sometimes you have to take the time to fill yourself to continue to be able to fill others. So certainly reach out. We're happy to help be a resource and provide anything we can in terms of resiliency work and things like that for your groups as well.
That's wonderful. So Ron Kellerman had a question for you, Nancy. What, in your opinion, are the most reputable WebMed info sites?
So a couple that are big go-tos for us that have really nice, kind of easy to read, concise information and have the largest database of updated information. Medlineplus is one. And National Institute on Health is always a great place to look. So Medlineplus is very general, covers the gambit of a lot of just different health issues. But Institute on Health will link you up to some other places as well. The National Institute on Aging is wonderful. If you're looking for, if you have somebody that still wants to be able to dial a phone and get a warm body, if you have somebody who still enjoys print materials and wants them mailed to them, if you have somebody that wants DVD videos of exercise programs they can do at home on their own, National Institute on Aging offers all those materials at no cost, and people can call and make the request. They can go online and make a request. So those are probably the most frequently utilized sources. You know, we have some different sources for our clinicians who are looking for a different type of evidence-based information, but for the general consumer, WebMD is okay. So we'd still push out to Medline, yeah, over that. So
wonderful.
Hey, Nance, do you want to share costs if there are any?
Yeah. So some of our programs do have a fee associated with them. And generally those are programs that are primarily for what we lovingly refer to as the worried well. So programming that that helps people better understand lifestyle choices, and they're making an effort to start changing things a little bit in their life in a healthy way. So cooking classes would have a fee associated with them if they were a general community-based class like the date night. We would have a fee associated with that would cover the cost of your food. And we don't ask for a fee to cover anything of our own expenses. These are, this is community benefit work that we're doing. So there are some fees for classes. They generally run anywhere from $5 for a class up to, if there's a series, some of our classes are weeks and weeks long, could be, 6 weeks of twice a week for a physical activity class. Those are $25. And again, that really has more to do with having people have some accountability. And we offer scholarship to anybody. It's not a requirement that you have to fill out any paperwork. If somebody expresses the desire to take a program and cost is an issue, we offer that program at no cost. All of our programs relating to addiction recovery, whether that's smoking cessation, minor in possession classes, things like that, are no cost. We try to provide those for nothing. So we try to do as low or no cost as possible, but also be fiscally responsible so that we can maintain our service, right? It takes a little bit to keep going. So yeah. Pediatric or parenting info. We work with the community hub for parenting classes, and so we can connect the dots. We used to actually offer parenting classes here, but we don't need to reinvent that wheel. There's a lot of agencies and organizations doing incredible work around this. And so we are much more inclined to work with those community partners. In fact, House being one of them, right, that can offer different types of education. So we would connect the dots to the organizations that are doing those types of classes rather than try to create our own. Weight loss classes I see is come up on here. What we have right now is we have a holistic weight management program. It is, believe it or not, it is not focused on weight in terms of numbers on a scale. It's focused on behavioral change, what that entails, proper cooking and preparation of food, just knowing what foods are nutritious and appropriate for the individual, working with previous thoughts, feelings, biases that may have built up that are barriers to change. It includes physical activity information and one-to-one coaching appointments. That is a 12-week program. And then what happens after people attend that program, they come once a week, which is virtual right now, is then they have access to what we call Lifestyle, which is a support group that goes on forever and ever and ever. And you can check in each week with the group and just kind of see where you're at and continue to ask questions and work through challenges as they come up. So that's what we have right now. It's called Holistic Weight Management. And it's available after work hours, yes.
Great. Other questions from folks? Oh, there we go. Oh, Cindy, you want to? That's incredible, the amount that you're giving back to the community. That's fantastic.
Yeah, Nancy mentioned that the CHEC does community benefit work. Don't understand that term. We are a not-for-profit hospital, and we are required by federal law and the IRS to give back to our community. One of the ways that we give back is through all the wonderful services and supports that Nancy and her team do for the community, which comes to a value of just under $2 million every year. So it's an amazing resource for our broader community. And right now, a lot of classes that Nancy mentioned, her staff has done an amazing job to make those digital, like we all are right now. And so you can access, those classes and attend via Zoom or WebEx or whatever we do. And you still get the opportunity to participate even though we're in a pandemic.
Fantastic.
And I would say I am so grateful. We have a lot of younger educators on the team, and thank goodness, because they have helped drag my sorry behind across the line into technology. And so, this, I think, the term pivot earlier, right, of just everything that we had done in the past had to be done differently. And so I'm just really thankful. We're now putting out podcasts. We're doing short video clips, you name it. It's all happening. Whatever way we can get out to the community is the way that we're charging ahead. So yeah, a little bit of in-person, little teeny bits, and hopefully we'll get back to that. But the nice thing is now we have all of those things in place moving forward so that transportation and other limitations won't be a barrier anymore. So this has been a win in the long run. It's just been a long haul to get there.
Exactly. So are the podcasts, Nancy, are those archived so folks could dig into them?
Yes. Yeah, they're actually not live yet because we've done, I want to say 6, but they're trying to build to 10 before they launch so that can, just look through the menu and choose what they want rather than only seeing what comes up each week type of thing.
Got it. Yeah. Okay, great. Thank you. We'll watch for that.
Thanks.
All right. If there aren't any other questions, thank you again, Nancy. It's always a pleasure and the CHEC is doing such wonderful work for the community and is much appreciated. And I think everybody, and you can tell from the chat, I think every time we have an opportunity to learn about all the great work that's being done, it surprises everybody. So having you share out and refreshing us on this is fantastic and really important. So thank you so much. And in honor of you, we and your time today, we're going to make a donation in your name to our very own Salem Rotary Foundation. So, yeah, so thank you so much.
You guys. I get to be part of the good work. Yeah.
And if we were in person, I'd have a kid's book for you to sign that would go to a shelter, but I'll get to that one day. So thank you again, Nancy. And thank you, Cindy, for bringing Nancy and the CHEC to us.
Yes, and we would love to reschedule that vocational tour whenever the world allows us to do that. That was ready for us last June, I thought, but it's great to see the space. It's really amazing. And that kitchen is so fun.
Absolutely. Okay, well, it's just playing on it. Yes. So to wrap up for today and give you a little bit of gift of time, Shane is our president-elect, and our program chair next week is a program on high impact technology. And the little bits and pieces I've seen in the previews, you won't want to miss this program either. So with that, we'll wrap up for the day, and everybody take care. It's wonderful to see your little tiled faces, and have a great afternoon. We'll talk to you soon.